In COVID's wake, how our politics failed us. This video is based on key insights from the book In COVID's Wake, How Our Politics Failed Us by Stephen Macedo. Chapter 1, Democracy Under COVID. Stephen Macedo looks back at the start of the COVID-19 pandemic in early 2020, a time filled with fear as hospitals, like those in Italy, were quickly overwhelmed. He notes how governments reacted in ways never seen before. Very quickly, almost half the people in the world were told to stay home or faced rules limiting where they could go. Businesses and schools were shut down, borders closed, and huge amounts of money, like over $5 trillion just in the US, were spent to handle the crisis. Macedo explains that leaders often used language like they were waging war against the virus. This wartime thinking meant that stopping the virus became the main goal, sometimes without enough thought about the downsides of the rules, like lockdowns or closing schools. He points out that governors often made big decisions on their own, without much input from lawmakers, especially early on. The government also tried to control what information people saw, asking social media companies to remove posts they called misinformation. Macedo explains how science got mixed up with politics during the pandemic. People's political views, whether they leaned Democrat or Republican, strongly influenced what they believed about COVID-19. This included how dangerous they thought the virus was, whether masks or vaccines worked, or even where the virus might have come from, like a lab in China. This political divide became so deep that people on different sides had trouble understanding or respecting each other's views. Macedo observes that people often dismissed ideas simply because they came from the other side, even if the ideas were worth discussing. For example, questions about how well masks worked, the real costs of closing schools, or the possibility the virus escaped from a lab were sometimes shut down because they became linked to one political party. This made it hard to have open and honest talks about the best ways to handle the pandemic. Stephen Macedo also discusses how public health leaders and organizations made mistakes. He notes that early estimates of how deadly COVID-19 were often too high because they were based only on the sickest people who got tested. Macedo points out that before COVID-19, many experts actually doubted that things like lockdowns, long school closures, or even mandatory masks for everyone would work well against a virus like this. They worried about the harm these rules could cause. But when the pandemic hit, many leaders quickly changed their minds, partly because of early reports from China, and pushed for strict rules without fully considering the plans they had before. He mentions that officials sometimes used slogans like "follow the science," which hid the fact that there was a lot they didn't know for sure, and that choices involved balancing different values, not just following scientific facts. Macedo highlights examples where scientists seemed to bend the truth, like when a group strongly denied the lab leak idea in a public letter without revealing their own connections to the research in Wuhan. He suggests that public health officials sometimes simplified information or weren't fully honest about uncertainties, perhaps believing it was necessary to get people to follow the rules, what some might call noble lies, which damaged public trust. Chapter 2, Following the Science Before COVID. Stephen Macedo explains how governments reacted to the sickness called COVID-19. Before this sickness came along, most experts and government plans agreed on how to handle something like the flu spreading. They thought that big actions, like telling everyone to stay home lockdowns, closing all the schools, or forcing people who might be sick to stay put quarantine, weren't very helpful. They worried these actions would cause a lot of problems for people, families, and businesses, and there wasn't much proof they actually stopped the sickness from spreading widely. Plans written just before COVID even said, we didn't know if things like face masks really worked for everyone. Macedo notes that when COVID-19 started spreading quickly, governments suddenly changed their plans. China locked down huge cities with millions of people. At first, experts in other countries were shocked and didn't think it was a good idea. But very quickly, leaders around the world threw out their old plans. They decided to copy China's approach, using strict rules like lockdowns and closing schools. Macedo says they did this even though their earlier plans warned these actions could harm society and the economy, and might not even stop the virus much. It seemed leaders were following new advice based on computer guesses about how the virus might spread and what the World Health Organization, WHO, suggested, ignoring the warnings from their own past experts. Sometimes, Macedo suggests, leaders might use tough rules because it makes them look like they are in control or doing something big, even if the benefits aren't clear. Macedo also talks about how science advice became confusing and seemed to take sides. Before COVID, there was a disagreement. Most health experts were doubtful about using strict rules, often called NPIs or non-pharmaceutical interventions, for sicknesses that spread through the air. They believed the downsides were too big and the benefits weren't proven. But there was a smaller group of scientists, especially those who made computer models to predict how sickness spreads, who were more hopeful. They thought these rules, if used early, could stop the virus. Macedo explains that during COVID, this smaller group's ideas, backed by their computer models, became very influential. These models often gave very specific predictions that made the rules seem like a sure thing, but they didn't focus much, or at all, on the huge problems these rules would cause for people's lives, jobs, and kids' schooling. Macedo says these models played a big role in convincing leaders to adopt policies that the older plans had warned against. Furthermore, Macedo points out that public health groups didn't always seem to follow their own science or past advice. Just months before COVID, the WHO had looked at the evidence for different rules. Their report said that for most situations, they did recommend tracing everyone a sick person met, quarantining people who were exposed but not sick, checking people at borders, or closing borders completely. They said there wasn't a good reason for quarantining large groups of people. Even in February 2020, when COVID was already spreading, the WHO advised stopping travel between countries. Macedo highlights that these health groups knew the evidence for most of these strict rules was very low. Macedo reminds us that respected experts and groups had warned about these issues years before COVID. Dr. D.A. Henderson, famous for helping end smallpox, argued that disrupting normal life as little as possible was the best way to handle outbreaks, and that strict rules like lockdowns would be impractical and harmful, especially to essential workers and children. Another group, the Institute of Medicine, cautioned against relying too heavily on computer models, saying they couldn't give perfect answers and leaders needed to think about all the costs and uncertainties. They stressed that leaders should be honest with the public about what wasn't known and the potential harm of the rules. Even civil rights groups like the ACLU warned before COVID that using force or strict rules in public health could hurt people's freedoms, breed distrust, and unfairly harm poor people and minorities. Stephen Macedo concludes that when the COVID panic hit, these careful warnings and the established scientific guidance were largely pushed aside in favor of drastic measures based on uncertain models, without fully considering the definite harm they would cause. Chapter 3, Turning on a Dime. Stephen Macedo explains that when China first locked down cities, because of COVID, health experts in America and other places were shocked. They thought shutting everything down was too costly and probably wouldn't even work. Before COVID, plans for sickness outbreaks didn't think rules like closing borders or shutting down businesses and schools helped much. But Macedo points out something surprising happened fast in early 2020. People started liking China's tough approach. Soon, countries all over the world were doing similar things, locking down big parts of society. The same experts and groups who didn't believe these rules worked suddenly changed their minds. They started supporting versions of China's plan. The World Health Organization, or WHO, is a good example Macedo gives. Even though the WHO's own plan from late 2019 said there wasn't proof these rules worked, and advised against closing borders or forcing people to stay home, they quickly praised China's actions in 2020. The WHO even sent a team to China with Chinese officials. This team wrote a report very quickly, by the end of February 2020 that strongly supported what China did. Macedo notes this report seemed to ignore problems, like China forcing people into their homes or silencing doctors who spoke out early. The WHO officials, like Bruce Aylward and Clifford Lane, seemed amazed by China's effort and unity, overlooking the fact that China's government could force people to obey in ways democracies couldn't. Macedo mentions emails suggest the report's wording was changed to please Chinese authorities, showing how science might have been bent for political reasons. Macedo highlights how this WHO report, which called China's response maybe the most ambitious, agile, and aggressive ever, told the world this was the only way. It recommended finding every sick person, tracking down everyone they met, locking them away, and watching everyone closely. The report failed to ask if this was even possible or right in countries that valued freedom. Despite knowing the virus had already spread to many countries and that China's data wasn't trustworthy, the WHO pushed China's plan as the model for everyone, even poor countries. This official support from a global health group helped convince governments to lock down. Macedo also discusses the role of scientific models. A team led by Dr. Neil Ferguson in London released scary predictions. They said millions would die in the UK and US if strict rules like closing everything and keeping everyone home weren't used. Macedo notes that Dr. Ferguson had a history of predicting much worse results than actually happened in past disease scares, like bird flu or swine flu. But his frightening COVID numbers got huge attention and scared leaders, like President Trump, into action. This shows how scientific predictions, even uncertain ones, became powerful tools influencing government decisions. In the US, Macedo explains, top advisors like Dr. Deborah Birx and Dr. Anthony Fauci showed President Trump the scary London model. Soon after, Trump recommended states close bars, restaurants, gyms, and schools. This led to the 15 days to slow the spread, which Dr. Birx later admitted was just a start to get people used to longer shutdowns. Government officials seemed to embrace the idea of controlling the virus completely, moving away from just trying to slow it down. Macedo points out that early on, some scientists and experts did speak out against these extreme measures. People like Greg Gonsalves, Rachel Maddow, Justin Lessler, Tom Frieden, Michael Osterholm, John Ioannidis, and David Katz warned that lockdowns had huge costs, especially for kids and poorer people. They questioned if the rules would even work against a virus that was already spreading widely. Some argued it made more sense to protect the old and sick while letting healthier people build up immunity. They worried the cure might be worse than the disease, causing massive economic and social harm. Even the Washington Post newspaper initially argued against a total lockdown. Macedo emphasizes it's important to remember these voices that were later ignored or silenced as the main opinion hardened. The idea took hold that society had to go into a kind of war mode. Groups like Harvard's Safra Center and the American Enterprise Institute put out plans calling for huge amounts of testing and tracking people's movements, maybe even using phone apps to control the virus after lockdowns. Macedo describes how influential writers like Ezra Klein looked at these plans and saw a future that wasn't normal at all, maybe even like a scary surveillance state, but felt there was no other choice to save lives. The government response shifted towards trying to completely stop the virus, pushed by health authorities and scary scientific models, even though this went against earlier plans and ignored serious warnings about costs and whether it could even succeed. Science seemed to become less about open debate and more about supporting one approved government strategy. Macedo contrasts this with Sweden. Sweden's government and health agency, led by Anders Tegnell, chose a different path. They decided locking down everything was impossible to keep up and wouldn't stop the virus anyway. They kept younger schools open, didn't close most businesses, and never ordered people to stay home. Their goal was to slow the virus down and protect the most vulnerable, accepting that the virus would eventually spread. Macedo notes Sweden was criticized harshly and called crazy by many other countries at first. But their top health experts believed lockdowns caused too much harm and wouldn't change the final outcome much. A year later, Macedo points out, Sweden ended up having one of the lowest rates of extra deaths in Europe, suggesting their less extreme government response, which trusted people to act responsibly without harsh mandates, worked out relatively well despite the early criticism. This shows they're an alternative government response, even if public health leaders elsewhere claimed there wasn't. Chapter 4, Partisan Pandemic. Stephen Macedo explains that making good rules during a big crisis, like COVID, needs open discussion, where people can disagree and share different ideas. This is important for a fair government. When new rules might have big costs as well as benefits, it's extra important to discuss them openly. Macedo points out that COVID policies created conflicts between different important values, like health and freedom, and leaders had to make tough choices. He notes that many leaders pushed for rules to keep people apart, like closing schools and businesses. They often presented the choice simply as saving lives versus helping the economy, without fully looking at all the other costs. While there was some debate early on, Macedo observes that disagreement became less tolerated over time. Governments focused almost only on stopping COVID deaths, ignoring other problems caused by the policies. Some experts even said there was only one way forward: strict rules keeping people apart until testing and tracing could control the virus. This led to very strict rules, like police bothering people walking alone outdoors, or very old people being kept in isolation for months, which caused great suffering. Macedo highlights shocking examples, like families not being allowed funerals for loved ones or women giving birth alone. These strict rules, pushed by powerful groups, also caused huge problems in poorer countries, like farmers losing crops and girls dropping out of school. Macedo feels that those who supported these policies haven't faced up to the severe harm they caused, and they often unfairly label anyone who disagrees as bad or immoral, stopping honest discussion. Macedo uses the example of the Great Barrington Declaration to show how science became tangled up with politics and how disagreement was shut down. This declaration was written by 3 experienced scientists: Dr. Martin Kulldorff from Harvard, Dr. Sunitra Gupta from Oxford, and Dr. J. Bhattacharya from Stanford. They were experts in diseases, how they spread, and public health. They worried that the main COVID rules were causing terrible harm to people's physical and mental health, hurting kids' education, and making health problems like heart disease and cancer worse. They believed these harms hit poorer people and younger people the hardest. Their idea, called focused protection, was to protect those most likely to get very sick from COVID, like the elderly and those with health problems, while letting younger, healthier people live more normally. This way, healthier people could build up protection, immunity, naturally, which would eventually help protect everyone. They weren't saying to ignore the virus. They suggested using resources wisely, like testing nursing home staff often and helping older people get groceries delivered. Macedo points out this wasn't a wild idea, but similar to standard public health, thinking before COVID, and how Sweden first handled the virus. They argued that lockdowns mostly protected wealthy people who could work from home, while essential workers, often people of color, had to keep working and face the risks without much extra help. But Macedo explains, the reaction to the declaration was harsh. Top government health officials like Dr. Francis Collins and Dr. Anthony Fauci wanted a quick and devastating takedown of the declaration. They shared articles from popular magazines, not just scientific papers, that attacked the authors and their ideas. One article Fauci shared called the ideas deadly delusions. Another expert, Greg Gonsalves, who had earlier warned about lockdown harms, now harshly criticized the declaration authors, even using angry language on social media. Macedo notes the unfairness of calling these scientists fringe when they were respected experts raising serious concerns. Their ideas were twisted and called a let-it-rip strategy, even though they emphasized protecting the vulnerable. Macedo also shows how public health leaders sometimes failed to follow the science or were dishonest. He points out the changing definition of herd immunity. Before the pandemic, herd immunity was understood to come from both people getting sick and recovering, or from vaccines. The World Health Organization's website said this clearly in June 2020. But later that year, Macedo notes, the WHO changed the definition on its website to say herd immunity was something mainly achieved through vaccination. This change ignored the protection gained from actually having the virus, likely to push the message that vaccines were the only way out. Macedo argues this was misleading and disrespectful, especially to people who had already recovered from COVID and had some protection. He also describes how officials and the media sometimes seem to manipulate the public by creating fear. They focused on rare stories of young, healthy people getting very sick or dying from COVID, making the risk seem high for everyone. Macedo cites expert Mark Woolhouse, who advised the UK government. Woolhouse was shocked that even leaders overestimated the risk to younger people. He reveals that a UK government advisory group suggested using hard-hitting emotional messaging to make people feel more personally threatened, even if the actual risk for their age group was low. Governments pushed messages like, "We are all at risk," which wasn't entirely true, as the risk was vastly different depending on age and health. Macedo believes this fear campaign aimed to make people follow the rules, but ended up causing unnecessary anxiety and hiding the fact that protection efforts should have focused more on those truly at high risk. Macedo further details how governments tried to control the narrative by working with social media companies to censor views they didn't like. Emails and court cases revealed that officials from the White House, CDC, and FBI pressured companies like Twitter and Facebook to remove or hide posts that questioned lockdowns, masks, or vaccines. Even posts by the authors of the Great Barrington Declaration were targeted. Macedo explains that YouTube removed videos of experts, including a Nobel Prize winner, who questioned lockdown policies, claiming they went against official health guidelines. Facebook even admitted removing factually true posts if they thought the posts might make people hesitate about vaccines. This censorship, Macedo argues, stopped open debate and prevented people from hearing different expert opinions. Finally, Macedo discusses the case of Dr. Scott Atlas at Stanford University. Atlas, who advised President Trump, questioned lockdowns and mask mandates, emphasizing the harm to children and the need to protect the vulnerable while letting society function. Many Stanford professors publicly condemned him, claiming he spread falsehoods and contradicted science, though Macedo notes they didn't provide specific evidence in their letter. Stanford's faculty senate even officially censured Atlas, saying his views were against the university's values. Macedo criticizes this reaction, pointing out that Atlas was raising valid concerns about policy trade-offs, and that the professors condemning him were acting like gatekeepers of truth rather than engaging in debate. He suggests this episode, like the attacks on the Great Barrington Declaration, shows how intolerant the environment became, making it hard for anyone, even experts, to challenge the main policies without being attacked or silenced. Macedo concludes that this shutting down of debate was harmful and went against the principles of both science and fair government. Chapter 5, Laboratories of Democracy. Stephen Macedo explains that, when the COVID pandemic hit, leaders had to make huge decisions even though they weren't sure what would work best. He notes that leaders talked a lot about following the science, but the truth is, the science wasn't settled. Experts themselves changed their minds often, especially early in 2020. Macedo points out that making these choices was tough because people's lives and the whole country were affected. According to Macedo, the U.S. government system let states try different things, like big experiments. During COVID, this definitely happened. Each state had to figure out its own plan. Some states put in strict rules quickly, while others were slower or had fewer rules. Macedo highlights that very soon, you could see a big difference between states led by Republicans and those led by Democrats. They went down separate paths. Macedo observes that this state-level experimentation didn't lead everyone to agree on the best way to handle the pandemic. Even though we could measure things like how many people got sick or got the vaccine in each state, people didn't agree on what worked. Instead of learning from each other, Macedo says the disagreements, especially between Republicans and Democrats, just got bigger. It seemed like people were living in different worlds, depending on their politics. Stephen Macedo points out a strange thing. Governors from both parties, whether they used strict rules or very few rules, claimed they did a great job handling COVID. And surprisingly, voters seemed to agree with their own state's leader, no matter the approach. Macedo notes that almost all governors got re-elected easily after the pandemic started, maybe because people tend to support their leaders during a big crisis. Macedo explains that government leaders faced a tough situation in 2020 because they had never dealt with a crisis quite like COVID before. He points out that the U.S. hadn't seen a pandemic this bad in a long time, and in past pandemics, things like ordering everyone to stay home or closing businesses across whole states just weren't done. The old plans didn't have clear answers for what to do, especially about things other than medicine, like masks or closing schools. Macedo mentions that experts in 2020 were really just making educated guesses about what rules might work. He quotes others who called the lockdowns a giant experiment because there weren't studies proving they would work beforehand. Even the CDC, a top health group, said early on that they couldn't find strong proof that things like masks or keeping distance would definitely stop the virus from spreading. Macedo emphasizes that there was no agreed-upon playbook for using rules like closures to fight a pandemic. Leaders in the states looked to the federal government for advice, Macedo says, but clear instructions didn't come until mid-March 2020. That's when top officials, standing next to the president, suggested widespread closures of schools and places where people gather. Macedo notes that the decision was ultimately left to the governors because the federal government doesn't have the power to make health rules inside states. So, the governors were the main decision makers. Stephen Macedo observes that from the very beginning, Republicans and Democrats saw the danger of COVID differently. Democrats were generally more worried. However, Macedo points out that at first, most Americans, no matter their party, supported the early rules like closing schools and businesses. But this agreement didn't last. Over 2020 and 2021, the two parties grew further and further apart on what they thought should be done. Macedo describes how states led by Democrats and Republicans started acting differently. While almost all states issued stay-at-home orders in March and April 2020, Republican governors were a bit slower and were the only ones who didn't issue official orders in some states. Macedo shows that the biggest difference was in how long the orders lasted. Democratic states kept stay-at-home rules much longer, sometimes for months, while Republican states often lifted them after about a month. School closures were another area where politics played a big role, according to Macedo. All states closed schools in spring 2020, but reopening was very different. Macedo notes that states led by Republicans tended to reopen schools much earlier, often in the fall of 2020. States led by Democrats, especially where teachers' unions were strong, kept schools closed for much longer, sometimes for the whole school year or even into 2021. Macedo highlights how groups like teachers' unions in big cities strongly opposed reopening, sometimes calling it unfair or even racist. Macedo explains that states led by Democrats also had stricter rules about things like wearing masks, limiting gatherings, closing businesses like restaurants or gyms, and travel. He shows that throughout 2020, Democratic states consistently had tougher restrictions than Republican states, even when the virus spread changed in different parts of the country. The rules didn't seem to change much based on how bad COVID was in a state at any given time. They mostly stayed linked to the state's politics. When vaccines arrived, Macedo notes, another political divide appeared. While states figured out different ways to give out shots, the main difference came down to how many people wanted to get vaccinated. Macedo points out that people in Democratic states were much more likely to get the vaccine than people in Republican states. This difference wasn't easily explained by things like education or where people lived. It seemed tied to political beliefs and vaccine hesitancy, which was higher among Republicans. Stephen Macedo then looks at what happened as a result of these different choices. He notes that, if you look at how many people died from COVID, the story changes depending on when you look. Before vaccines were widely available, Macedo shows there wasn't much difference in death rates between Republican and Democratic states, even though they had very different rules about masks, closures, and staying home. The strict rules in Democratic states didn't seem to lead to fewer deaths during that time. However, Macedo points out that after vaccines became available to everyone, a clear difference emerged. States with more vaccinated people, which were mostly Democratic states, started having significantly lower COVID death rates. Republican states, where fewer people got vaccinated, had higher death rates. Macedo says this pattern holds up even when looking at individual people's risk based on their party registration in states like Florida and Ohio. The gap in deaths between Republicans and Democrats grew after vaccines arrived. Macedo clearly links higher vaccination rates in states to lower COVID death rates. He explains that the states where more people got vaccinated had fewer deaths overall. While state policies on vaccine distribution or requirements might have played a small role, Macedo suggests the big driver was people's willingness to get the vaccine, which was strongly tied to their political views. In contrast, Macedo finds that the different rules states used before vaccines, like stay-at-home orders, school closures, or business restrictions, don't seem to be connected to how many people died from COVID. He shows that states with stricter rules, or states that acted faster, didn't end up with lower death rates during the pre-vaccine period. Whether a state locked down early or late, kept schools closed long or short, or had tough or light restrictions, it didn't clearly predict fewer COVID deaths back then. Macedo acknowledges that figuring out if a specific rule worked is tricky because many things were happening at once, and people changed their behavior even without government orders. But he emphasizes that even more complex studies confirm his simpler finding. Looking across the states, the strictness of rules like lockdowns or mask mandates doesn't line up with lower death rates before vaccines, while higher vaccination rates clearly line up with lower death rates later on. He also notes that other factors already present in states, like the age of the population or general health, like obesity rates, also played a big role in COVID outcomes. So, did we learn clear lessons from states trying different things? Macedo suggests the answer is mostly no, especially regarding rules like lockdowns and closures. He points out that even years later, health experts and scientists still don't agree on whether those rules actually saved lives or how much good they did compared to their costs. Studies give conflicting results, and Macedo mentions major reviews concluding that we still don't have solid proof about which rules were effective. Some research even suggests that while rules might have slowed the spread of infections temporarily, they didn't necessarily change the overall death count. Macedo concludes that the idea of states being laboratories of democracy didn't really work out during the COVID pandemic. Instead of learning from each other and agreeing on what policies were best, politicians and the public became more divided. Leaders in both parties stuck to their approaches and claimed success, and voters seemed to approve of whatever their own leaders did. Macedo finds it concerning that in today's politically charged world, it seems very hard for people to learn from experience and agree on how to solve big problems, even when facing a crisis like the pandemic. Federalism allowed different states to do what their people wanted, Macedo notes, but it failed to produce shared lessons about good policy. Chapter 6. Pay Any Price. Stephen Macedo looks at how decisions were made during the COVID-19 pandemic. He notes that leaders often focused only on stopping the virus, overlooking many other big problems people faced. For example, when New York's governor was asked about people who lost jobs and couldn't get help, he suggested saving lives from COVID was more important than worries about money, stress at home, or feeling sad and alone. Macedo points out this way of thinking was common among leaders during the pandemic. Macedo explains that governments, when figuring out how to handle the crisis, mostly listened to experts on viruses and diseases. they didn't seem to weigh the good things about rules like lockdowns against the bad things, like kids missing school or businesses closing. It was like they were only looking at one side of the coin, how to stop COVID-19. Macedo finds this strange because these rules affected everyone in huge ways. He says that even before 2020, experts planning for pandemics knew that things like closing schools or businesses would cause massive problems, hurting people's health and lives in many ways, not just financially. But during COVID-19, these warnings were mostly ignored. According to Macedo, government advisory groups often didn't include experts who could talk about these other costs, like effects on mental health, children's learning, or the economy. Key figures like Dr. Fauci and Dr. Birx later said their job was just to focus on the public health side, meaning stopping the virus, and that thinking about other impacts, like the economy or school problems, was for someone else to figure out. Dr. Francis Collins admitted they put all the value on saving a life from COVID and basically zero value on how much messing up people's lives, the economy, or kids' education might cost society later. Macedo thinks this was a failure because leaders needed to consider everything, not just one disease. He notes that earlier pandemic plans in places like the UK actually recommended having a wide range of experts involved and making decisions based on balancing health with social and money issues. Macedo observes that science itself got tangled up in politics during the pandemic. Leaders would often say they were just following the science when making rules. But Macedo suggests this was sometimes a way to avoid taking responsibility for difficult choices that had winners and losers. The science they followed was usually just about stopping the virus, ignoring other scientific knowledge about how shutdowns affect people's well-being, learning, or jobs. He also points out that disagreements about pandemic rules became very divided along political lines, like between Republican and Democratic states in the U.S., which handled things differently and saw different results in areas like job recovery. Furthermore, Macedo highlights that it became difficult for scientists or thinkers to even talk about the downsides of pandemic rules. Some who tried to study or question the costs, like the harm from school closures, faced harsh criticism or attacks. This discouraged open discussion about whether the rules were truly worth the harm they caused. An idea seemed to take hold that there wasn't really a choice between health and the economy, that strict rules were best for both. Macedo questions this, saying it wasn't clear that lockdowns actually worked perfectly or that everyone agreed on how much risk they were willing to take. Macedo argues that public health leaders didn't always follow the broader science available, especially the knowledge gathered before 2020. He notes that earlier pandemic plans had warned about the exact problems that arose, that closing schools and businesses would hurt poor people more, cause mental health issues, and create ethical problems. The World Health Organization itself had pointed out that measures like quarantines, border closures, and stopping gatherings could unfairly harm certain groups and limit basic freedoms. Yet during COVID-19, these known risks were pushed aside. He believes public health authorities sometimes failed the public by focusing too narrowly. By admitting they assigned zero value to the massive disruptions caused by the policies, figures like Dr. Collins showed a mindset that ignored overall well-being. Macedo also mentions ethical concerns raised by the pandemic response, like using fear to make people obey rules, putting essential workers at risk, keeping families apart even during final moments, and causing deep loneliness, especially among the elderly in care homes who were isolated for months. He points out the irony that after years of policies causing isolation, the Surgeon General later declared loneliness a public health crisis. Macedo suggests that not being clear about the goals of the restrictions, were they to flatten the curve, stop all deaths, or eliminate the virus, made it impossible to judge if the policies were rational or when they should end. Chapter 7, Science Bends to Politics. Stephen Macedo looks at the COVID-19 crisis and how people disagreed strongly about who was to blame. He notes that many people in the middle or on the left thought President Trump did a bad job handling the virus and listened too much to people who didn't trust vaccines or believed strange ideas. They felt these people didn't follow the science. But Macedo points out that many people on the right saw things differently. They thought powerful people on the coasts, like Dr. Anthony Fauci, were using the pandemic to control regular citizens with rules about masks and vaccines. Some even called it a plandemic. These critics also worried that Fauci and others might be hiding their part in funding risky science called gain-of-function research, which tries to make viruses stronger for study. Macedo observes that arguments about COVID became extremely divided, even more than usual in politics. He thinks about James Madison, one of America's founders, who knew that strong feelings often take over, especially during big crises like a pandemic, making it hard to think clearly about what's best for everyone. Macedo uses two big COVID debates to show how this happened. The argument over whether the virus accidentally leaked from a lab in Wuhan, China, and the argument over whether masks really help stop the virus. He says that in both cases, people on both sides became very angry and wouldn't listen to the other side, even though the evidence wasn't clear-cut. Macedo explains that the idea the virus might have leaked from a lab, possibly the Wuhan Institute of Virology, which studied similar viruses, was quickly attacked. People who suggested it were called conspiracy theorists or racists. But Macedo argues that the risk of lab leaks was known long before COVID. He also points out that important U.S. health officials, like Dr. Fauci, had reasons to not want people looking too closely at the lab leak idea because they had connections to that kind of research. Macedo suggests there's now good reason to think Fauci and others tried to stop people from seriously considering the lab leak theory. He explains that gain-of-function research is when scientists experiment to make germs more contagious or dangerous. Governments might fund this to prepare for bioweapons or to find cures for future diseases. But Macedo stresses that this research is very risky, even if done for good reasons. He lists examples of dangerous germs accidentally leaking from labs in the past. He notes that even scary movies and books often use the idea of a lab leak causing disaster. Macedo writes that despite the dangers, which led the Obama administration to pause some gain-of-function funding in 2014, officials like Dr. Fauci and Dr. Francis Collins, head of the NIH, supported it. They argued it was needed to create vaccines and treatments. In 2017, the pause was lifted. Macedo highlights that Fauci's agency, NIAID, funded gain-of-function research at the Wuhan lab through a group called EcoHealth Alliance. Fauci was reminded of this early in the pandemic, just before he seemed to start efforts to push back against the lab leak idea. Macedo points out that Fauci privately admitted knowing the Wuhan scientists were doing gain-of-function work. Macedo notes that Fauci publicly tried to define gain-of-function very narrowly, only counting research expected to create super deadly and contagious viruses. But Macedo says common sense, and even the NIH's own definitions, suggest any research expected to make a germ more transmissible or harmful counts. He refers to recent confirmation from another top NIH official that the NIH did fund such research in Wuhan. Macedo argues that public officials should be open about funding dangerous research, but instead, there seems to have been hiding and dishonesty. He mentions emails showing top NIH officials, including Director Collins, plan to avoid directly answering Congress's questions about the Wuhan funding, hoping to run out the clock. Macedo describes how, early in 2020, some top scientists like Jeremy Farrar and Christian Anderson became worried. They thought the new virus looked like it could have been made in a lab, especially since it appeared in Wuhan, home to a major virus lab. Anderson found features in the virus, like its receptor binding domain and furin cleavage site, that seemed perfectly designed to infect humans, almost like following a how-to manual he found in a scientific paper co-written by the Wuhan lab director. Farrar was so scared about the possibility of a lab leak, maybe even linked to bioweapons, that he got a secret phone and held secret meetings. He contacted Fauci, who then told Anderson to gather experts quickly. Macedo finds it significant that Fauci also told Anderson that if they confirmed the virus seemed engineered, they should report it to the FBI and MI5, British intelligence. Macedo thinks this might have scared Anderson and shifted the focus from a scientific question to a potential crime or security threat. Macedo explains that a conference call happened on February 1, 2020, with Anderson, Farrar, Fauci, Collins, and other powerful science funders and experts. Anderson shared his concerns about the virus features and the low safety levels, BSL-2, at the Wuhan lab. However, Macedo shows how things changed rapidly after that call. Anderson and his colleagues started working on a paper, but their goal became, as Anderson wrote privately, trying to disprove any type of lab theory, even though they felt the evidence wasn't conclusive. Macedo points out that other scientists on the call, like Ron Faucier, who did gain-of-function research himself, pushed back strongly against the lab leak idea. Faucier argued it was an accusation that needed proof beyond reasonable doubt, a very high legal standard usually used in criminal trials, not typically for scientific questions where evidence is still being gathered. Macedo suggests Faucier wanted to protect gain-of-function research from criticism. Collins also quickly shifted towards favoring a natural origin, worrying about conspiracy theories harming science and relations with China. Macedo reveals private messages where Anderson and his co-authors admitted the lab leak was highly likely or even friggin' likely, because the Wuhan lab did that kind of work and the virus data fit. They worried about the lab's low safety standards. But they decided that accusing China, even of an accident, would cause a shit show. They felt politics was getting mixed into the science, but concluded they should publicly support the natural origin theory. So Macedo explains, they wrote the paper, The Proximal Origin of SARS-CoV-2. Even though Anderson privately told an editor they couldn't disprove a lab origin, the published paper strongly stated the virus was not a laboratory construct. Macedo says this bold claim was designed to shape news headlines, and it worked. Top officials like Collins and Fauci promoted the paper's conclusion, calling the lab leak idea debunked, without mentioning their own involvement or the author's private doubts. Macedo describes another effort, led by Peter Daszak of EcoHealth Alliance, the group funding the Wuhan lab. Daszak organized a letter in the famous medical journal The Lancet, signed by 27 scientists. The letter condemned conspiracy theories about the lab leak and insisted the virus came from wildlife. Macedo criticizes this because the lab leak was a possibility based on known risks, not a wild conspiracy. He also highlights Daszak's huge conflict of interest. If the virus leaked from research he funded, he could be in trouble, yet the letter claimed no competing interests. Daszak also claimed support from the U.S. National Academies, NASEM, but Macedo shows their statement was actually more cautious and didn't fully endorse the natural origin theory. Daszak later bragged privately that these efforts stopped serious investigation into the lab leak. Macedo argues that these actions show how powerful scientists, some with clear conflicts of interest, work to control the story about COVID's origins. They seemed worried about damaging science's reputation, upsetting China, and harming their own careers or research areas. They unfairly put the burden of proof on the lab leak theory while promoting the natural origin theory, even when the evidence was uncertain. Macedo finds it shocking how deeply politics seem to influence the science right from the start. He believes the scientists involved may have thought they were preventing a bigger crisis by hiding the possibility of a lab leak, perhaps fearing President Trump couldn't handle it or that China would stop cooperating. But Macedo argues these were political judgments, not scientific ones, and these scientists had no right to make them secretly for everyone else. He believes they misled the public and officials. Even if there was a reason for secrecy early on, he says they should have come clean later. Their failure to do so raises questions about whether self-interest, like protecting their funding and reputations, played a role. Macedo contrasts how President Trump faced voters, while Dr. Fauci retired with praise from the same media outlets that had dismissed the lab leak idea. He criticizes journalists and scientific journals for being too quick to label the lab leak a partisan conspiracy theory, often linked unfairly to racism, instead of investigating it properly. He notes that even years later, it's hard to have an open discussion, with scientists needing safe spaces just to suggest investigating the lab leak, which Macedo finds worrying. He stresses that understanding the origins is vital for preventing future pandemics and deciding how to regulate risky research like gain of function. Macedo points out that definitions are still unclear, allowing labs, like one at Boston University, to create modified viruses and deny its gain of function. He argues the public needs to debate the risks and benefits of such research openly. Macedo concludes that the lab leak theory is no longer a fringe idea, citing the Energy Department and FBI assessments and recent expert testimony to Congress suggesting strong evidence for a lab origin and potential scientific fraud in the Proximal Origin paper. He also mentions criticisms of a later paper trying to prove the Wuhan market was the origin, pointing to flawed data and analysis. Finally, Macedo reflects on how the crisis showed that educated experts aren't always neutral. They can have their own interests and biases, just like any other group. He feels COVID highlighted a growing gap and distrust between elites and other citizens. He argues that we need checks and balances when scientists get involved in politics, just as we do for politicians, because their power can also be misused. Chapter 8, Politicized Science. Stephen Macedo looks at how the government handled the COVID-19 crisis, especially regarding masks. He explains that early on, top health experts like Dr. Fauci and the U.S. Surgeon General told people not to worry about wearing masks. They said store-bought masks didn't offer much protection. This matched what plans for handling sickness outbreaks usually said before COVID. But then things changed fast. In April 2020, the CDC suddenly recommended that everyone wear cloth face coverings in public. Later, rules were made requiring masks in certain places, like federal buildings or on planes, especially after President Biden took office. Macedo notes that mask rules weren't the same everywhere across the country. Different states and cities had different rules. Often, places led by Democrats put stricter mask rules in place, following advice from government agencies like the CDC. Schools became a big focus, with many requiring children, even very young ones, to wear masks all day. These school rules sometimes lasted a long time, even when mask rules were dropped elsewhere. Macedo thinks this shows how government responses can change quickly and vary a lot from place to place during a crisis. Stephen Macedo also describes how science got caught up in politics during the mask debates. It felt like people picked sides and wouldn't listen to each other. He points to 2 opinion articles in the New York Times newspaper as an example. One writer strongly argued that mask rules did nothing, while another writer just as strongly argued that science clearly proved masks worked. Macedo says both writers acted overly sure, when the real science was actually uncertain. This shows how people often claimed science was only on their side, making it harder to have an honest discussion. Macedo explains that even smart scientists couldn't agree. A big review of studies, called the Cochrane Review, concluded that based on the research looked at, it was uncertain if masks helped slow down viruses like the flu or COVID. Some experts respected this review, noting it wasn't really new information. But other experts who believed masks worked strongly disagreed with the review, calling it wrong. There was even a public disagreement between the review's main author and the head editor of Cochrane, who apologized for how the review's findings were worded, possibly because of pressure. Macedo uses this example to show how scientific findings could become part of a political fight, making it hard to know what to believe. He also points out that people who questioned mask rules were often treated unfairly or called names, which shut down important conversations. Stephen Macedo argues that public health leaders sometimes failed to follow the science, didn't communicate clearly, and seemed to push certain ideas. He reminds us that at the start of the pandemic, officials like Dr. Fauci, the Surgeon General, the CDC, and the WHO all said masks weren't necessary for the general public. This advice matched previous thinking. But then they completely changed their advice, telling everyone to wear masks, including simple cloth ones. Macedo finds this sudden switch confusing and suggests it wasn't clearly explained by science. He also says officials weren't clear about what kind of masks they were talking about, cloth, surgical, or N95s, or what working really meant, protecting the person wearing it, or stopping the spread in the whole community. This lack of clarity made it hard to understand the real evidence. Macedo points out that officials sometimes promoted studies that seemed weak or flawed. For example, he discusses a study in Denmark and one in Bangladesh that were used to argue masks worked. But Macedo notes that the studies themselves admitted the results weren't very strong or clear. Macedo highlights a specific case where the CDC, under Dr. Rochelle Walensky, strongly recommended masks for all kids in school. This advice relied heavily on one study from Arizona that claimed schools, without masks, had much more COVID spread. However, Macedo reports that other experts found huge flaws in this study, calling it ridiculous. Another analysis that found no benefit from masks in schools wasn't published by the CDC. This suggests officials might have focused on evidence that supported their recommendations while ignoring evidence that didn't, and they didn't fully consider the downsides for children's learning and social life. Macedo believes health officials should have been more honest about the uncertainty and listened more openly to different viewpoints and concerns. Chapter 9, Noble Lies. Stephen Macedo explains that sometimes people in charge, like government leaders and experts, think they know what's best for everyone. They might believe that regular folks can't understand complicated problems quickly enough. So, Macedo notes, these leaders might be tempted to keep secrets or even lie, thinking they are doing it for the good of the public. This idea comes from a writer named Cicely Bach. Macedo points out a problem called groupthink. This happens when a group of experts know each other well and start agreeing too much. They might start believing their group is super smart and good, and anyone who disagrees is wrong or even bad. Macedo says this makes them ignore warnings or different ideas. They might think that because their goals are good, anything they do to reach those goals must also be good, even if it means hiding things or making decisions that hurt some people. Macedo reminds us that big mistakes, like during the Vietnam War, happened because smart people got caught in groupthink and didn't listen to different voices. He finds it surprising that leaders who grew up seeing those mistakes seem to repeat them during the COVID crisis. According to Macedo, during the COVID pandemic, something like this groupthink seemed to happen again. He suggests that groups of powerful experts and officials made big decisions without enough public discussion. They often seemed sure they were right and didn't share all the uncertainties with the public. Macedo thinks they might have believed they were acting in the public interest, but maybe they were also trying to protect their own reputations, jobs, and power. Cicely Bach warned that leaders often say they are lying for the public good, but underneath, they might just be covering up mistakes or trying to stay in charge. Macedo uses the debate over where the COVID virus came from as an example of science getting mixed up with politics. He describes how Dr. Robert Redfield, a former head of the CDC, suspected early on that the virus might have come from a lab in Wuhan, China. Redfield thought certain features of the virus looked unusual. But Macedo explains that other top scientists, like Dr. Anthony Fauci and Dr. Francis Collins, strongly pushed the idea that the virus came from nature. Macedo notes that Redfield felt he was excluded from important discussions because he didn't agree with the official story. Macedo points out that Fauci and Collins had reasons to maybe not want the lab leak idea discussed. The NIH, which they were linked to, had funded research, including some potentially risky gain-of-function research at the Wuhan lab. If the virus came from that lab, it would look bad for them and that type of science. Macedo suggests that calling the lab leak idea a racist conspiracy theory was a way to shut down debate, a political move rather than a scientific one. He thinks this shows how science got tangled up with protecting reputations and pushing a specific story, rather than openly exploring all possibilities. Macedo argues that public health officials made mistakes and didn't always follow the best principles during COVID. He explains that slogans like "follow the science" were too simple because dealing with a pandemic involves hard choices with many trade-offs, not just science. Decisions about lockdowns or school closures affected jobs, mental health, and kids' learning, but Macedo feels these costs weren't discussed enough. He believes experts were given too much power, acting like they should be on top, making all the decisions, instead of just giving advice on tap. Macedo agrees with thinkers like Louis Anthony Dexter, who warned that experts can have tunnel vision, focusing only on their area and ignoring other problems, and they often come from similar backgrounds, not understanding the lives of ordinary people. To fix this, Macedo says we need checks and balances. He believes elected leaders, like members of Congress, have a job to question the experts. Because they represent regular people, they can ask tough questions, point out problems experts might ignore, and make sure different views are heard. Macedo thinks this questioning is important even if the experts are right, and it's crucial when the experts might be wrong. This helps balance the power of experts and make sure decisions consider everyone, not just what the experts think is important. Macedo also criticizes how public health officials communicated with the public. He mentions Dr. Paul Offit, a vaccine expert, who felt officials pushed COVID booster shots for everyone, even young, healthy people, when the evidence wasn't very strong. Offit said officials told him privately that a simple message, "Everyone get boosted," was easier, even if not perfectly accurate, because it might get more high-risk people vaccinated. Macedo argues this kind of noble lie, where officials mislead people for what they think is a good reason, is disrespectful and damages trust. He points to the changing definition of herd immunity by the WHO, which initially included immunity from getting sick, but was later changed to focus only on vaccines, likely to encourage vaccination. Macedo believes being honest, even about uncertainties and downsides, is better in the long run because people deserve the truth and discover lies eventually, leading to more distrust. Macedo expresses concern about the rush to label ideas as misinformation. He discusses a study published in a medical journal that called several ideas misinformation, including the possibility of a lab leak, doubts about mask effectiveness for kids, the value of natural immunity after infection, and claims that the government worked with social media to censor content. Macedo points out that there is actually reasonable evidence or debate supporting many of these points. He worries that powerful groups, like medical associations or even the government, are trying to control what information is allowed, acting as judges of truth. He mentions the Missouri v. Biden case, which showed government officials pressuring social media companies to remove posts they didn't like. Macedo warns that giving experts or the government the power to censor ideas they disagree with is dangerous for free speech, science, and democracy, especially since, as COVID showed, the experts can be wrong or biased themselves. He also notes studies showing scientists sometimes want to censor research for moral or social reasons, which can backfire and reduce public trust. In conclusion, Stephen Macedo sees the COVID response as a lesson in the dangers of expert groupthink, the mixing of science and politics, and officials misleading the public. He argues these actions created deep distrust between elites and the broader public. Macedo believes that instead of experts thinking they know best and hiding information, we need more honesty and open discussion. He thinks leaders and experts need to be more humble, admit what they don't know, and trust regular citizens to handle complex issues and disagreements through democratic processes, even during a crisis. Chapter 10, Concluding Reflections. Stephen Macedo explains that, when the COVID crisis hit, governments seemed to forget their own carefully made plans. Before COVID, people had studied past pandemics and decided that big shutdowns probably wouldn't work well and would cause lots of problems for people and businesses. Plans from groups like the World Health Organization even said trying to completely stop a flu-like virus, once it started spreading, was pointless. But Macedo points out, when COVID arrived, fear took over. He says leaders panicked, influenced by scary predictions and intense media coverage. They quickly threw out the old plans. Instead, they ordered massive shutdowns and restrictions, things like telling everyone to stay home. It was like leaders felt they had to do something big to look like they were in charge, even if experts knew these actions hadn't been tested and might not work well once the virus was everywhere. Macedo gives an example involving Andy Slavitt, who advised President Biden. Slavitt was told by experts early on, in March 2020, that it was likely too late to stop the virus completely in the U.S., and that lockdowns would only do so much. But Slavitt hoped the U.S. could still crush the virus like China seemed to be doing. Macedo suggests this focus on saving every possible life, while sounding good, ignored the huge costs of the shutdowns and whether they could realistically succeed. Both Trump's and Biden's advisors pushed for these strong actions, sometimes using shaky evidence from past events like the 1918 flu pandemic, evidence that hadn't convinced pandemic planners just a year before COVID. According to Macedo, science itself got tangled up in politics during the crisis. Instead of open debate, there was pressure to agree on one approach. Public health experts often presented a united front, using simple phrases like "follow the science," which Macedo believes shut down important discussion about different viewpoints and the trade-offs involved. He notes that disagreeing with the main narrative could get you labeled unfairly, like calling scientists with different ideas fringe, or dismissing questions about the virus's origins as conspiracy theories. Macedo argues that this wasn't how science is supposed to work. Science grows through disagreement and questioning. He feels that during COVID, this process was often blocked. Experts, influenced by the desire to seem unified or perhaps by their own biases, sometimes overlooked evidence that didn't fit the story that strict measures were always best. Data showing that places with fewer rules weren't always doing worse, or that reopening didn't automatically cause huge spikes, was often ignored. Furthermore, Macedo criticizes how public health authorities handled the situation. He thinks they failed by trusting early information from China too easily, and by quickly adopting China's lockdown model, without enough proof it would work elsewhere or considering its massive side effects. These experts focused mostly on stopping COVID infections and deaths, which is understandable, but Macedo says they often ignored the wider damage their policies caused to kids' education, people's jobs and mental health, and the economy. Macedo states that public health officials were treated like the only experts who mattered, even though decisions affected all parts of life. He believes they sometimes used people's fear to attack those who wanted a more balanced approach that weighed the good against the bad. They pushed for goals like zero COVID, long after it was clear the virus couldn't be eliminated, locking everyone into costly policies with no clear way out. Macedo also points out that officials sometimes seem to bend the truth, like changing the definition of herd immunity or downplaying the immunity people got from recovering from COVID to fit the policies they favored. He believes this manipulation and the failure to be honest about uncertainties damaged public trust. And that brings us to the end of our summary of this book. I hope you found it insightful and valuable. If you enjoyed this video, hit like and subscribe for more. Your support helps us bring you more great content. Thanks for watching.